Hi, this is Dr. Danto, and I am going to chat with you today a little bit about Pediatric OMT here at the Danto Osteopathic Clinic. The first baby I treated was my own when she was 2 months old for torticollis. Her pediatrician noted that she wasn't turning her head to the left, and he gave my wife some home stretches and prescribed physical therapy. At that point in my career, I was just starting out in practice. When my wife called me with the diagnosis, I was actually at a conference learning how to use a percussor, which is a machine that a brilliant osteopath had explored using as an adjunct for the hands-on practice of OMT. Interestingly, he was in his 80s, and at that point in his career, he had shifted his practice to primarily treating children. So I used the percussor on our daughter when I got back to Michigan, and much to our amazement and surprise, she was about 85% better after one treatment. And after a second treatment, she was about 95% better. A month later, I brought her to one of my mentors who was an expert in the field with many more years of experience than I had at that point. He did a bit more work on her, but her torticollis was already gone by the point where he was examining her. I just wanted to make sure that we didn't miss an opportunity to help our daughter with OMT. Since those early days in my practice and training, I've probably attended a couple hundred hours in courses designed to educate physicians in treating children with OMT. I've had the opportunity to treat a lot of children and train students and residents in the skills of OMT to the pediatric population. Every time I'm given the opportunity to treat a child, I appreciate what a miracle they are, and I am humbled by how readily their bodies accept the treatments. In a way, the application of OMT on children is harder because all of their anatomy is smaller. On the other hand, the way a child's body integrates a manipulative treatment is amazing and humbling. Newborn babies in the hospital have been the youngest patients that I've had the opportunity to treat with OMT. These opportunities occurred while I was working at the Northeast Regional Medical Center in Kirksville, Missouri. Kirksville is considered by many as the mecca of osteopathy because the founding College of Osteopathic Medicine is still in operation there and has been for over 100 years, graduating students since its very onset. There is a great deal of pride in delivering outstanding osteopathic medical care in the Kirksville community. Consequently, when a child is born and the nurses note any difficulty with the baby suckling or feeding, and it is pointed out to the pediatrician, who then orders a consult to the osteopathic manipulative medicine department. Serving as a specialist in that department, I had many opportunities to treat newborns in need. Previous to being in Kirksville, while in my private practice in Michigan, I occasionally saw babies having similar problems about a week after their delivery. And thinking back to those experiences, I'm not saying this to condemn our current medical system, but I feel there are probably many newborns who may be being needlessly put on formula to supplement their feeding difficulties due to the normal birth process and the somatic dysfunctions that may result as part of that process. And these are amenable to osteopathic cranial manipulative medicine as well as osteopathic manipulative treatment. In a perfect world, I pray that these services are more readily available. And from personal experience, I think about the mothers who are getting negative messages that the problem is somehow their fault in the way they are breastfeeding their babies. One of my mentors, Dr. Viola Fryman, did some amazing research studies on children that found a significant number of them had sustained some somatic dysfunctions due to the birthing process. Children with a higher number of these dysfunctions had greater incidence of being symptomatic. This parallels studies that we've conducted on adults that showed adults with more significant somatic dysfunctions also had more symptoms. The adult studies also reflected that those patients with more abnormal musculoskeletal findings had more improvement with OMT, and it would make sense that children would respond the same way. Dr. Fryman also did studies on developmentally delayed children that reflected that OMT normalized their development faster than children who did not have the opportunity for the OMT during the same time frame. The outcomes for OMT on children can be spectacular. 1 or 2 treatments may be all a newborn may need to start feeding better, become less colicky, or both. We usually recommend follow-up around the same time as a well baby exam. The reason for this is that well baby exams are designed to match growth spurts in normal development, and it is during these growth spurts that a strain pattern from birth or trauma sometimes reemerges. If nothing reemerges after a few of those well baby follow-up visits, then I often recommend to parents that we can follow up on an as-needed basis, like when the child has an injury or trauma, or there is a change in behavior or a new symptom develops. On the other hand, a newborn with a misshaped head may require treatment every couple of weeks for years because the bones may be slow to change once a shape or general structure has been imprinted upon them. Babies are not the only children that benefit from OMT. The great thing about OMT is that it is treatment without pharmaceutical medication. Kids have all sorts of problems from headaches, neck and back pains to stomach problems that may be helped with OMT. I'm always willing to examine a child and try a little OMT to see how they respond. If everything matches up and I think that OMT will be beneficial, then I will let you know. At the Danto Osteopathic Clinic, our goal is to normalize and optimize your child so that they can thrive in mind, body, and spirit. Thanks.